BC teachers say the new commercial where you appeared in a classroom was false advertising. It was misleading because it only showed 6 students and they were in physically distanced desks. Do you think teachers have a legitimate argument that that commercial simply isn't reflective of what the classroom environment will actually look like in September under the current plan?
So I think we need to realize that that was not a commercial about what a classroom was going to look like. What that was me as the public health officer talking with children about children and their parents about the things that they can expect in the new school year, about some of the public health issues. And it was a conversation that I had with, there were more than 6 children. We had it in a classroom because that's what the children wanted. And it was an opportunity to answer the many questions that I was getting from children. So it was an opportunity for us to speak to children about some of the things that will be new and different and help them answer their questions that they had about what would happen. So it's certainly not meant to represent. We recognize that every classroom around the province looks different. And the ad reflects that. And it reflects as well a number of different age of children because it was the conversation that I was having with children about what to expect and to try and allay some of the anxieties and challenges that children and their parents are facing about what it's going to look like when they go back to school. I also want to say that, we all had masks and we talked about when we would wear them, but each child made their own decision about when they were going to wear a mask, and some of them wore them the whole time we were together, and some of them put them on and off at times when they needed to wear them. So this again reflects what we are going to be seeing in classrooms in a few weeks.
Do you have a follow-up, Shannon?
I do. With the start of school fast approaching, will the province look at increasing restrictions in other areas to try to reduce overall community transmission in the hopes of reducing risk at schools? Like, for example, maybe greater restrictions on indoor venues where people gather, like bars and nightclubs?
Yeah, so what we have done from the very beginning is look at where we're seeing transmission, and we've adjusted the orders to try and address those issues, and we have been successful in doing that. When we look at where transmissions are happening, they're happening in many different areas in our community, and we can't always put in orders to change those. And I think we need to, as we've been talking about today, we all need to realize that going into the fall is the next phase of what we need to think about. And it means we all need to take a step back and look at our contacts again to make sure that we can support those important parts of our society, like going to work, like making sure that schools are successfully opened again, and as we say, reflect what's going on in our communities. We still have very low transmission rates in our communities, and it's not one sector or the other that we can shut down, for example. It's not an either or. We need to be able to make to balance all of it as we go forward, and it's a very challenging thing. I think none of us signed up for a pandemic, and we're learning as we go, and we will adjust as we go, and we'll continue to learn and make the changes that we need. But now we need all of us to take a step back and refocus. We've been in that messy middle for the last few months, and we've been able to do a lot of things that we hadn't been able to do for quite a few months. And that's because we all worked together and got the rates quite low here in this province. And now we need to go back to that as we're moving into what we know is respiratory season. We know there's going to be more challenges ahead. And this is where our time to prepare for that and to get back to our basics again. So there's a couple of things, but and I'll let Minister Dick speak to that as well. But when we're talking about schools in a regular day-to-day basis for schools, what we're looking at is the classroom as your unit of connection, and that is a set controlled environment, and we know it'll be the same children every day that will be in that small group with the same adults every day. The numbers of teachers and children that they'll interact with is contained and limited, and we will have distancing within those classroom settings, within those small numbers of groups of children. So it is a different scenario than bringing together a variety of children who go to many different schools, including that school, for a limited time to spend time with kids that are not in their social connection or not in their learning group. group. So it's a different situation entirely. But I'll let you.
I think it's important to recognize that this communication, this ad, is a public health ad, and its intention is to deliver a public health message about what people can expect when they return to school, what children can expect, what teenagers can expect, what parents can expect. And so the messages were very similar to messages that have been delivered in public health ads throughout our time here, that we're going to need, all of us are going to need, to wash our hands a lot, to stay home when we're sick, that you'll have to wear a mask sometimes, and that you'll be mostly with the same group of teachers and friends. So the effort here is not to engage in what is, let's face it, a robust debate about the back-to-school plan, but for the public health officer to deliver a public health message to people in the province who may not have heard us here at 3 o'clock, but would need to hear that message, because school will look different this year. We all know that. We know that there is very significant anxiety around there around back to school, as there has been amongst reopenings that have occurred since the beginning of COVID-19. And I completely respect the concerns of teachers, the concerns of parents, the concerns of students. And part of delivering a public health message, a very specific public health message here, about washing your hands, about staying home when you're sick, about the need to act differently in terms of a school environment, is an important message to deliver. It's a public health message. It's not a message intended to get involved in a public policy debate. It's a public health message. I think the provincial health officer delivered that message very well in conversation with children. What it is not is a representation. It's not central casting. It's an effort, it's a conversation, and was a conversation between the provincial health officer and children. And in that sense, I think it's useful. I think the broader debate, of which we're very respectful, will continue to occur. It's very important that fundamental public health messages be heard by everyone in the province, including parents, including children.